Activated, your window into how we can change the way in which we aspire for persons with disabilities, how we change our expectations from seeing inability to expecting ability. Activated takes us on a journey of taking lessons from persons with disabilities in how we must do things differently to unleash the contributions persons with disabilities can and must make to building a disability-inclusive Mzansi. Hello and welcome to Activated with me, Taryn Tomlinson. Persons with disabilities are often viewed as the recipients of medical care, but not as the providers of such care. This week, we meet people working in the health sector, making a difference and changing attitudes. Now, let's get activated. In today's program, Dr. Jacques Lloyd has been lobbying for disability rights for more than 25 years. He takes us on a journey on the impact of introducing peer support and counselling services in both urban and rural areas across Africa. Dr. Sarah Whitehead is a medical doctor and a person with a physical disability who discovered her passion and enthusiasm for physical rehabilitation medicine. I spoke to Dr. Watermeyer, our studio guest. His research often focuses on the intersectional ties between disability, disability inequality, and mental health. Working with patients and dedicating their lives to healing the sick and injured, healthcare professionals are sensitive to the needs of those in pain and distress. But how more sensitive would a medical professional be who themselves has had first-hand experience of living with a disability? Living with quadriplegia for 35 years following a water skiing accident, Dr. Jacques Lloyd takes us on a journey on the impact of introducing peer support and counselling services in both urban and rural areas across Africa to empower newly disabled people. Let's meet him. For more than 25 years, he has been lobbying for disability rights. Dr. Lloyd regularly does accessibility assessments and counsels newly injured persons with spinal cord injury. In addition, he participates in fundraising and training of people with disabilities.
I was born in Pretoria. I had a diving accident in 1988, and my life totally changed there. I was fortunate to have a very good family and friend circle who supported me really well. I got involved with the Western Cape Rehabilitation Centre, and I started doing visits at the rehab centre in just talking to people with disabilities. The first thing that I learned there was that I needed to know my body. I needed to understand my disability. And I think that's the major problem that people with spinal cord injuries have. Not understanding their disability. Not understanding the crucial challenges when it comes to health components, as in how to manage your bladder, how to manage your bowel, how to look after your skin, how to stay mentally sharp and positive. When it comes to peer support, you as a peer supporter needs to be educated. You need to understand what that person's situation is, and then you also need to understand your community and your health system around you, so that if you identify challenges, that you can then either give the person a solution on where to go to, or to refer the person to a organization or a institution where they can get the information. Peer support meant a lot to me because it changed my life. After that, I could see that it definitely made a huge difference in the people that I got involved with. Other side. In the early 2000s, we did a research program on the life expectancy of a person with a spinal cord injury in Uganda. And we found that the life expectancy was between 6 months and 1 year. A paraplegic, 2 years, 2.5 years. After we implemented our peer support programs and we educated nurses at hospitals, that changed to a life expectancy of 10 years less than the normal life expectancy. So totally changed the lives of people with disabilities. The borders that you set for yourself can be either at the doorstep at your home or on the horizon. But set your boundaries for the horizon. Just plan properly to get there.
After the ad break, we visit Dr. Sarah Whitehead here in Cape Town, a medical doctor and a person with a physical disability herself. Our guest for the afternoon is Dr. Brian Watermeyer, a clinical psychologist, disability studies academic, and a person with a disability. We'll be right back after this. Welcome back. Today I have the pleasure of talking with Dr. Brian Watermeyer, a clinical psychologist and disability studies academic who has joined me to share some of his knowledge. Hello, Brian, and welcome to Activated. Do you ever sleep with all the reading and writing that you do?
I've been asked that before. It does take up a lot of my time, but when you have a personal interest in a particular social issue, there's a lot of motivation around it. So I don't sleep a lot sometimes, but I enjoy my work very much.
Brian, I consider myself to be a hobbyist psychology student. I'm particularly fascinated in the role the mind plays in either creating disease or healing it. Your main research, however, focuses on the links between disability, mental health, and inequality. Where did this specific interest arise?
Well, it's something which requires a lot of attention because, in South Africa, I think we are quite familiar with the fact that people experience socially engendered disadvantage for all sorts of reasons. Particularly, we're familiar with the idea of disadvantage in relation to race, also in relation to gender. But we are less familiar with the reality of socially caused disadvantage in relation to disability, because we tend to think about disability as something which is a problem with the body, a problem with the individual, whereas in fact the reality is that the sort of social destinies of people with disabilities are far more determined by whether or not they live in a society which makes provision for accommodating their needs than the nature of their bodies. It's not about the nature of bodies, it's about the nature of society and whether or not we create a society that's inclusive. And we are able to do that. Unfortunately, at the moment, though, our society is not particularly disability inclusive. And that means that people with disabilities come up against barriers to participation and experiences of exclusion, also experiences of stigma.
And then switching from the educational to the health environment. I believe that the health environment can be very intimidating to people who acquire a disability as they work through their stages of acceptance. How important or relevant is having access to persons with disabilities within the rehabilitation team for the healing process of the individual?
It's extremely important that people with disabilities, someone who's acquired a disability, also people with congenital disabilities who grow up with disability from a young age, it's extremely important that those people have adequate access to health and rehabilitation services. But I want to say that the most important thing to emphasize here is that those services need to be appropriate, they need to be empowering, and they need to be supportive. And, unfortunately, in terms of healthcare around the world, we still have a long way to go in terms of training health professionals and creating health service installations which are truly welcoming to the needs of people with disabilities. And that's for a range of reasons. I mean, you might find that just the physical environments in which health services take place might not be accessible. You might find that in health services installations, there are no health professionals who can speak, say, South African Sign Language. And so that means that healthcare is not equally accessible to people who are deaf or hard of hearing.
Absolutely, Brian. And then in conclusion, what advice could you give in order to build a healthy frame of mind when you have a newly acquired a disability?
So that's a difficult question because, disability is a journey, but then life is a journey, identity is a journey. And, and I would argue that all of us, disabled or non-disabled, we have parts of ourselves, our identities, our bodies, our sense of our inner life, parts of ourselves which we don't like very much, or which we feel uncomfortable with, or which we need to develop a comfortable relationship with over time. And disability is no different. Mm-hmm. You'll find, though, that as people with disabilities or someone who's acquired a disability over time grows into understanding that part of himself or herself as part of their identity, as something unchangeable, as something which shapes their life and shapes who they are, that more and more disability doesn't become a sort of problematic add-on. It becomes just a part of who one is.
Dr. Brian, thank you so much for joining us. And I'd just like to know, are there any other words you'd like to leave with our viewers?
Well, I guess I'd just like to say that, as a society here in South Africa, we've spoken so much about inequality in relation to race and gender, and that's important, and we need to continue that conversation. Everyone knows, we've got a long way to go in terms of creating a more equal society in those terms. But we've only just started thinking about disability as part of this diversity debate, and I'd really like to encourage us to begin to make those connections and think, well, disability inequality, and we see terrible inequality and poverty in the lives of people with disabilities. It's just another form, another axis of inequality, of social injustice in our society, which needs to be addressed, like race and like gender. And we need to make those connections and start moving towards a society which is more inclusive.
Thank you so much, Dr. Brian, for joining us. Dr. Sarah Whitehead is a medical doctor and a person with a physical disability. After Sarah graduated and started working, armed with a unique knowledge of what it's like to be both a patient and doctor with a disability. During her community service year at Western Cape Rehabilitation Centre, she discovered her passion and enthusiasm for physical rehabilitation medicine. Let's meet her. She realized how her own disability provides her with a level of empathy, enabling her to develop an instant and meaningful connection with her patients. Because of her unique position and voice within society, she has taken on a disability rights advocacy role. During her work in in-hospital physical rehabilitation medicine, she became increasingly aware of the challenge physical disabled people face when they leave the supportive environment of inpatient rehabilitation and must now piece their domestic lives back together with little or no support. This awareness caused the idea to develop of creating a stepping stone between in-hospital rehabilitation and someone's return to living as full a life as possible.
When I graduated, I knew nothing about disability, and very little I didn't know. But all medical focus. So it was through my personal experience having disability and through my professional experience as a physical rehab doctor that I learned about the importance of the biopsychosocial model and adopting that approach. So I try where I can. I try and educate my colleagues who are really qualified. But I think a much better approach is to target medical students, the people who haven't graduated, so that when medical students graduate, and they're also equipped with the knowledge, the skill, and attitude to afford people with disability with quality healthcare. When you receive that sort of diagnosis, it's devastating. You feel with what a sort of hopelessness. You think the future is very dark, and that introduction to a health professional or peer support from someone that is returns a little bit of hope and helps someone in a very dark period. I want to empower people with the rights and skills to live as independently as possible.
Ek glo nie Dr. Whitehead sal my nog onthou nie, maar ek het haar 'n paar jaar gelede in die Kaapse Rehabilitasiesentrum ontmoet. After the outbreak, we visit Dr. Maasdorp, gynecologist and obstetrician, and he tells us more about how his life experience as a medical specialist continued after acquiring his disability. Disability Info South Africa assists persons with disabilities and their families in accessing information on the type of services available to persons with disabilities. Let's find out more. On the website, you can find quite a few disability organizations. These organizations can assist you by providing information, support, services, or assistive devices to persons with disabilities that may require assistance. The website is truly user-friendly, and here you will find 4 major search headings: for mobility impairments, for hearing impairments, for visual impairments, for intellectual impairments. Let us take the first one. For mobility impairments, we click on it and then can decide where we would like to go next. Let us click on cerebral palsy. We then click on organizations that might be able to help you with info and contact details. You can do it for all 4 main categories. If the companies listed cannot assist you, you can use the search facility to search for a product that you require. Click on your type of impairment and the area or province where you live, then click on the disability group you are looking for and hit search. Disability Info SA bevat interessante inligting vir persone met gestremthede en definitief die moeite werd om te besoek. Nou eers tyd om 'n draai in Gauteng te maak by Dr. Maasdorp, ginekoloog en verloskundige. Hy vertel ons meer oor hoe sy lewenservaring as mediese spesialis voortgegaan het na die verkryging van sy gestremdheid. Sy manier waarop hy pasiëntsorg benader, sy lewensbalans en wat sy uitdagings was.
I'm Maasdorp, gynecologist at Garden City. I acquired my injury during my training as a specialist. It's a traumatic disability, so it was difficult to pick up from there. Stubborn as I was, having the great support from my wife and family, we started looking at how do I get back to work. As a gynecologist, it's very difficult. You need to be able to stand up, operate. The work itself is demanding. So we had to do a lot of research. The primary changes were attitudes. I think if people change their attitudes, that people with disabilities can still continue to work. My equipment to function fully as a gynecologist is essentially my chair. I've got a stand-up chair when I operate in theatre. I still drive my own car. I still continue going around the hospital. As long as there's access, I can get in and I can get around. With regards to how I approach my patients, there's a lot of empathy. I know how it feels like to be a patient. It's a little easier for me to understand when a patient says I can't or it's difficult for me. So yes, I think the disability has opened my eyes. I think before that it would have been very easy for me to say that, this is not, why can't it be done? It must be done. A profession like obstetrics and gynecology is very difficult to balance. There are many Valentine's Days, Christmases, New Year's, birthdays. My wife has either sat in a car waiting for me, sat at home, family waiting for me to get home. So balance has always been difficult. Being in a wheelchair has not made it any easier. Bottom line is you need to be quite stubborn to do this. This is a permanent situation, so the sooner you deal with it, the better. There are many things that you can continue to do, sports, going out, holidays, families. All these things should continue as long as you're willing to do that. You push the boundaries. You should be able to do.
Wat 'n ongelooflike lekker storie van Dr. Maasdorp. But before we go, Julius van der Walt has cerebral palsy, a condition that affects all of his limbs. He has very little use of his arms and hands and no use of his legs. He began creating abstract art using an iPad in 2011 and described it as an emotional outlet. His art is spontaneous, and we end our show with a short montage of his work. Bly veilig. Tot volgende week, selfde plek, selfde tyd.
Ik kan denk dat hier schilderij van mijn bijlag en betaal nooit een schilderij. Voor die tijd niet alles gebeurt spontaan en ik geniet. Dit is voor mij emotionele proces en dit is ook voor mij emotionele uitlaat. Dank je dat jullie komen kijken naar wat ik kan doen. En het was een voorrecht voor mij om bij jullie te weten wat ik kan doen.